Good morning. This presentation is about the role and responsibility of healthcare professional. According to the World Health Organization, human happiness is linked with better health. They believe that healthy population are more useful to the economy and are more productive. In this presentation, we're going to look at the background of the current healthcare profession, as well as the role and responsibility of nurses in the UK. We're going also to look at the professional bodies of nurses in the UK and the different changes that have affected the role recently before we finish with the impact of a multidisciplinary team in the healthcare sector. Presently in the UK, a healthcare professional is someone that is registered with a professional body, is associated with a discipline, and follow the rules and regulations of that body in order to practice. Healthcare have been shaped by many things, such as people's culture, the politics, and scientific development. In history, we find that in the past, people were using healthcare in everything that they were doing, and we even found that there is evidence of high medical practice in places like ancient India or China or Egypt. In England, medicine professionals before the other healthcare professionals, and healthcare professionals such as nurses and midwifery were delayed because women were denied many rights in the past. It was female emancipation that brought healthcare professionals such as female-dominated healthcare professionals such as nursing and midwifery forward, as well as the other healthcare professionals, as well as the other healthcare profession. Until the mid-20s, nurses was seen as a vocational profession. It was Florence Nightingale which influenced nursing positively by creating the first nursing school in the 1800s. And modern of nurses is even influencing the professional nursing today. Before, the role of a nurse was very broad, and nurses was associated with unqualified, was seen as an unqualified profession. Also, there were highly qualified nurses that provided high quality of care. It's Project 2000 that was the beginning of establishing nursing as a graduate profession and move nursing training from hospital base to university. Now we are going to look at the present role and responsibility of nurses in the UK. According to the Royal College of Nursing, nurses use clinical judgment in the provision of care to enable people to improve and maintain or recover their health, to cope with health issues, and to provide the best quality of life, whatever the disease and disability, until death. As adult nurses is also described by the general nurse by the midwifery, the Nurses and Midwifery Council, as as a provision of care for adult patients over the age of 19 to elderly people with different support needs in various settings. In other words, what nurses do is to look after the well-being of a patient's mental well-being and physical well-being. They educate their family, they educate the patient, they're there to support them, to advocate on their behalf, using the knowledge and the skills and the knowledge and skills and experience in order to provide an holistic care, taking into account the NHS value and the 6 C's. The present role and responsibilities of nurses in the UK. We continue by saying that the role and responsibility of nurses has broadened recently due to many factors. Nurses now have the ability to study up to degree level of PhD and many career pathways have been created in the NHS. Nurses play a key role now in maintaining patient safety and helping the NHS meeting their expectation. Now we have different type of nurses that are highly qualified, such as matron or advanced or specialist practitioner that can take decision, work on their own, take decision of their own, and run, um, even have their own caseload. Here we can see some of the emerging roles in the nursing profession, such as educator, leader, manager, researchers, care providers. The professional bodies for nurses in the United Kingdom are the Nursing and Midwifery Council and the Royal College of Nurses. They keep an updated record of nurses and they set the standard for the profession, for the members, for education trainings and code of conduct. And wherever there is a problem, the Nursing and Midwifery Council investigate to see whether the nurse is fit to continue to work as a nurse or not. The Nursing and Midwifery Council safeguard the public by investigating nursing and by setting the standard for the practice. And it has been established in 2002. Here are some of the core values. So they set the standards, they look after, take care of the registration of nurses, and make sure that they validate that the education are up to date and they are fit to practice in order to safeguard the public. And we also have the Royal College of Nurses, which is a trade union, is a trade union and represents also is also a professional body. It represents the rights of the nurses, midwifery. It has more members such as nurses, students, and care assistant. It contributes to policies that will help the profession go forward. Here are some of the priorities of the Royal College of Nurses. So the different changes that have affected the profession recently, according to Upton and Brooke, they say that changes happen at many levels: political, social, technological, scientific, or economical level. And this change is to help the workers in the industry or the people involved with the work, like the interagency, to become more efficient in the management of resources and the delivery of services in order to improve the experience of patients. So in the NHS, there have been at the political level, the NHS budget is determined by the government, and also it's determined by the government, and this affects the delivery of care. But since the NHS has been created, all the policies that have changed have something to do with the vision embedded in the NHS Act 1946, which is to provide the UK population with both mentally and physical better well-being. So healthcare professionals today, such as nurses or other healthcare professionals, have become more accountable to patients and and about their actions and their decision making. At the political level, again, we talk about the political level, we can talk about the organizational level. Organizational level happen in the healthcare professional in order to increase efficiency, as we said before. The Care Community Act 1991, the Care Community Act 1991, for example, has seen a reorganization of healthcare in the NHS. in order to improve internal competition and efficiency by introducing the internal market. Organizational changes also happened um, as a as a result of reports such as the Francis report, which identifies area for underperformance in the NHS and underperformance area in the NHS and make recommendations such as make recommendation which saw the 6Cs as part of improving and meeting these underperformances. Organization, when we talk about organization changing, we can also talk about the Health and Social Care Act 2012, which as a result of which the CCCGs replaced the primary care trusts uh, in 2013, and this has been one of the greatest organizational change in the NHS. Now, talking about the different changes that have affected the role recently at the economical level, we can say that we said already that the government allocate the budget, but also the budget is also affected by the economical condition at the time, by inflation and everything, and this factor also this factor also affects the way the budget is allocated. So because the government needs to meet the demand of many sectors, the budget is restricted. And because of inflation and demographic growth as well, um, has been prioritization in the budget of the NHS in order to reduce health inequality, but this does not always favor everyone in the every group of customer of patient or of employee. For example, with adult nurses, before they used to receive money from the NHS to train, but now our nurses and other healthcare professionals have to take a loan as a result of that. At a social level, we can say that social changes they have their roots in the pressure on the services. People now live longer, and there is a need for to treat long-term condition, which put really a pressure on the NHS. The people also are more educated about the healthcare and want to take a more an increased part in decision making. So there is a certain change in health problem, and now it's sickness, many new sickness such as cancer, many cancers or sickness that obesity bringing many sickness or sicknesses that are linked to with poverty. So in order to cope, care NHS is restructuring care and creating new ways of delivering care such as clinical pathway. Technology also is influencing the way care is delivered. Doctors use technology now to examine patients. Healthcare professionals use technology in their everyday activities to communicate with patients or between themselves to save file and everything. So patients also use technology now. They go on app, they go on website to have information. They can also do consultation over Skype or have an electronic prescription. So technology is also has changed the way care is delivered, but at the same time, technology has some drawback that healthcare professionals, special adult nurses, has to consider when they deal with confidentiality. As digital information can be vulnerable to virus or be easily hacked. To the adult nursing, there have been many changes recently to the role. Now adult nurses, as we say, are able to study for degree level, even for PhD level. And also think there have been new career pathway in the NHS now that they can take. The role also has evolved in order to cope with the NHS demand and the customer demand. According to the modern agency, the new role and services created within nursing now have allowed A&E to reduce by 70%. Has allowed A&E to resist wasting time for arrival to transfer and attendance by 70%. This is a really good increase, and nurses is making a difference to the profession. But the cut to birth rates and funding also is affecting the profession negatively. Now we're going to talk about the impact of a multidisciplinary team in the healthcare sector. According to GOAL 2005, who investigates the effectiveness according to GOAL 2005, multidisciplinary team is a group of professionals working together to deliver the best care outcome to a patient. So in order for a team to work properly, there should be a good communication, a key member to regulate the team, and a key member to regulate the team. The patient should be at the center of the team in order to provide an holistic care. Clinical pathway, for example, and models that have been created to nurses process are models that have been created to manage a multidisciplinary team. The multidisciplinary team also can have various sizes depending on the complexity of patient's sickness. Here is a model of a multidisciplinary team, and you can see the patient is in the middle and all the professionals are around him or her. Here also is a model of a nursing process. As you can see, it's a continuous cycle, and depending on how the patient is feeling, the cycle goes round to find what is the problem and how to fix it and deliver an holistic care to the patient. Multidisciplinary team can have some advantage and some disadvantages. Among the advantages, there is fewer chances of bias because many people are involved in the team. Good practices reinforced, and we believe that there is a better communication, better management of resources. A multidisciplinary team disadvantage also can be that individual goals are overshadowed. There is a problem of control of communication in a large team and problematic of allocation of resources. Some healthcare professionals believe that more autonomy will help overcome these disadvantages. Talking about the effectiveness of a multidisciplinary team, placing all assets that the effectiveness of a team rely in relationship to people in cancer in the UFA, and confirm that the multidisciplinary team had advantages for life-threatening diseases and complex treatments. But where there is poor communication, failure can be devastating, and they believe that for decision making and coordination among healthcare professionals can help maximize the outcome of a multidisciplinary team. So to conclude, we say that adult nursing is regulated in the UK by the Nursing and Midwifery Council. The adult nursing work as part of a multidisciplinary team in order to provide an holistic care to patients. That the profession has greatly evolved in recent years, and that adult nursing are now performing adult tasks and taking more responsibility due to the new demands on the NHS. The healthcare professionals are now more accountable for their actions and decisions due to patients being more educated and more involved in the decision concerning their health. Thank you for watching.